So Morgan, what was your undergraduate major?
Biology, and then I got a certification in genomics.
Okay. So, one thing that always, along these lines of some of the resources we might have in terms of our different departments here at University Park, one of the things that's always intrigued me is, this notion of information and the world changing very fast. Presumably it's based on science. Hopefully it's based on science, but we know that there's incredible amounts of variation in how well science is conducted and how solid the results are. Even in a randomized controlled trial, there's some probability that the finding, may not be correct, or it may not work across kind of all patients, right? There's a probability associated with that. So along this idea of kind of research and learning about science and incorporating that into the curriculum, given your experiences that you've had this year and talking with some folks at this campus, have you thought about that, and will the curriculum in any way teach medical students about scientific evidence and design and how to develop that?
Absolutely. I think something that a lot of medical schools are doing is the evidence-based medicine. So really understanding how to read a paper, understand a paper, take those findings and apply them, which we've done actually a few times this year. But I do think with our discussions and having the small group setting, that we will be able to tackle questions like that. We've talked a lot about guidelines, so national guidelines for different types of, let's say, breast cancer screenings, prostate cancer screenings, things of that nature, what is known and what should be done. And so kind of those controversial issues that you're alluding to, we do talk about, and that's one of the best things about our campus is that we've created this culture where it's okay to ask any question. It's not a stupid question, and nobody's ever going to tell you, no, don't ask that. We have those conversations, and we talk about, I think back to the conversation we had about mammograms. And so what is the recommendation, and what should we be doing, and what's the evidence surrounding that? And so having those conversations is very much at the table and with our curriculum and with our culture. And so that obviously furthers our learning and helps us to personally develop and then professionally develop as well.
And that's changed a few times in the past years, hasn't it?
Yeah, and that's, we talked about prostate cancer screenings. I mean, this is not something that it's black and white. There's always gray. Most of the time it's gray. And so having those conversations about when you are a physician, when you are ready to practice, what do you do and how do you make those decisions? Because often it's not the content that you're worried about, it's how to make the decision about the content that you're training.
Even in this year, there have been a couple of public health new issues that have come out. So the whole idea of offering hepatitis C virus screening to everyone, the whole mumps outbreak and how should we address that, those were real life problems that the medical student design partners got to really sit down and look at the evidence and sort of hash out, well, what protocol should we really do and what's the evidence to support that? And I think those are two really good examples of that in action, of taking the information that's out there and really building something that's going to be sound and thoughtful.